Good afternoon. My name is Andrew Narber, and this is my head to toe assessment. All right. Good afternoon. My name is Andrew. I'll be a nursing student today. I'm going to go ahead and close the door for your privacy and perform hand hygiene. While I'm doing this, can I get your full name, date of birth, today's date, and what brings you in today?
Mary Park, 6/30/88, December 4th, 2020, and I'm here for a wellness exam.
All right, Mary. I'm just going to go ahead and go over a few questions with you before we get started. Answer to the best of your knowledge.
Okay.
All right. Do you have any current health issues, health concerns?
No.
Any history of health diagnosis?
No.
Any family history of health diagnosis?
No.
All right. Any past surgeries I need to know about?
No.
All right. Are you on any medications or any allergies?
No.
Any tobacco use, smoking,
No.
alcohol use?
No.
All right. Have you had any recent weight changes?
No.
Okay. So as far as pain goes, on a scale of 0 being no pain, 10 being the most pain you've been in, if you were in pain right now, what would you note that as?
0.
All right. So today we have an adult female present in the clinic here. She is dressed, well groomed, dressed appropriately for the occasion, well appearing. She's sitting comfortably and in no acute distress, no pain noted, and she's alert and oriented ×3 with a Glasgow Coma scale of 15. All right, so we're going to go ahead and start with your head to toe. And as I'm going through, I'm going to ask a few more questions, okay?
Okay.
All right. I'm going to start with your skin. Do you have any rashes, moles, or lesions that I need to be aware of?
No.
All right. Let's go ahead and inspect the skin here. All right, I'm just going to palpate this with the back of my hand. All right. Skin is pink, warm, dry, and intact bilaterally and on the exposed skin throughout the body. Cap refill is good, under 2 to 3 seconds. All right, so we're going to head to the head. Have you had any headaches or experiencing any headaches or neck pain at all?
No.
All right, I'm going to go ahead and palpate the top here. All right, no tenderness, no lesions noted, and the hair is well equally distributed. So we're going to go ahead and note that as atraumatic and normal cephalic, and no tenderness or swelling, and upon palpation of the face as well. All right, while I'm doing the face, I'm just going to ask you to do a real quick thing for me. Can you puff your cheeks? All right. Smile for me, frown for me. Raise your eyebrows. Stick out your tongue and say, ah. All right. Let's go ahead and, so cranial nerves are intact. So let's go ahead and head to your eyes. Have you had any loss of vision at all?
No.
All right. So in inspection, eyes are located by symmetrical bilaterally. And I'm just going to do a real quick test of your eye movements, your EOMs. So watch this pin, just follow it. And I'm going to bring it in here. All right. Accommodation is noted, EOMs are noted, and just bring the light in from the side to each eye. Check your pupils. All right. So pupils are equal, round, and reactive to light and accommodation, so perla is noted. All right. So we're going to head down to your nose. Have you been experiencing any loss of smell at all?
No.
All right. I'm just going to have you occlude one nostril and do the same thing to the other side and breathe normal. All right, so nares are patent bilaterally. The nose is located midline. No discoloration, pink in color throughout. Now for the ears, have you experienced any loss of hearing at all or pain, tenderness?
No.
All right, upon palpation of the auricles and tragus here, there's no breakdown of skin, no tenderness, no discoloration. That's bilaterally, and we're going to go ahead and head down to the mouth. Go ahead and stick out your tongue again. Say ah. All right. Tongue is moist, pink. Tonsils are no swelling in the tonsils. Teeth look good and no redness or swelling in the gums. Any loss of taste at all?
Nope.
All right. I'm going to head down to your throat and neck here now. So, have you been experiencing any soreness in your throat, problems breathing or swallowing, any cough at all?
No.
Any history of thyroid disease?
No.
All right. So the trachea upon inspection is midline, no deviation to the sides. And I'm going to go ahead and palpate your cervical lymph nodes here. All right. There's no lymphadenopathy noted bilaterally on the lymph nodes. I'm going to go ahead and palpate and auscultate the carotid here. I'm going to do that bilaterally as well, one side at a time. All right, when I auscultate this, I just need you to hold your breath, take a big deep breath and hold it. All right. So with the carotid pulse, we are at +2 bilaterally, no Broad's noted. All right, we're going to head down to your upper extremities, okay?
Okay.
So have you had any pain, swelling, or achiness in your joints, your shoulders, elbows, or wrists?
No.
All right. Now I'm just going to go ahead and do range of motion.
Okay.
Okay. So just copy what I do and get through this, okay? So go ahead and lift your arms up. This is abduction. Put them down to your side. That's adduction. Go ahead and put them forward. And I'm going to have you push outwards and pull inwards. All right. Put your hands like this, like you're carrying a bowl of soup. All right. Now flip them over like you're pouring the soup out. All right. So supination, pronation noted. Go ahead and flex your arms in and extend them. All right. So full range of motion on upper extremities bilaterally. And the muscle strength is going to be a +5 bilaterally. All right. So while we're doing this upper extremities, I'm going to go ahead and do the brachial and radial pulse as well. So brachial is going to be right here. And radial pulse. And those are going to be +2 as well for both sides bilaterally. All right. So let's go ahead into your chest. Have you been having any shortness of breath or problems breathing?
No.
All right, so I'm going to go ahead and auscultate your lungs here. I'm going to take a listen here. Begin with at the apex. Just breathe normal for me. I'm going to do that bilaterally. Second intercostal bilaterally. Go ahead and turn sideways for me here. I'm going to come to the back. And listen to the upper, mid, and lower. All right. Go ahead and sit normal here. All right, so lung sounds are clear upon auscultation in all areas, posteriorly and anteriorly. All right. We're going to go ahead and do the heart. So have you been having any heart issues, heart pain, chest pain, or palpitations at all?
No.
All right. We're going to go ahead and take a listen to your heart here. We're going to note the S1 and S2 as well. I'm going to start here at the aorta and pulmonic. And that's the AV valves. S1 is heard clearly. I'm going to go to the Erb's point here. The tricuspid and the mitral. And those are the semilunar valves, and S2 is noted clearly. All right, so sounds good. Heart sounds good. We have good heart rate and rhythm in all fields, and no murmurs detected at all. And S1 and S2 is clear, clearly heard. So now we're going to go ahead and head down to your abdomen. All right. Have you been experiencing any abdominal pain or issues, discomfort, any changes in bowel movements, diarrhea, constipation? No. All right, I'm going to go ahead and take a listen here and identify the quadrants here. So this is going to be the right upper, left lower, and right lower. And I'm also going to take a listen here at the abdominal aortic. I'm going to listen to each quadrant here. And then abdominal aortic. All right, so bowel sounds are present in all quadrants and no bruits noted at the abdominal aortic. Now we're going to go ahead and do a light palpation on each quadrant as well. And then a deep palpation on each quadrant. All right, so upon palpation, light and deep palpation in all quadrants, there's no masses detected, no tenderness or pain. All right, so let's go ahead and we're going to head down to the abdominal aortic, going to head down to the lower extremities. All right, so have you had any pain or discomfort in your joints or muscles?
No.
Any swelling or edema in the ankles or feet?
No.
Right. Just going to go ahead and inspect the feet real quick here for swelling. Any discoloration at all?
No.
Right. No edema noted, and no discoloration. Just coloration is pink and uniform bilaterally. I'm going to go ahead and locate the popliteal pulse here. The posterior tibial post right here. And then the dorsalis pedis pulse right here. I'm going to do that bilaterally, and I'm going to also do that bilaterally, and that's going to be +2 bilaterally in all fields. All right. Let's see here. So we've done the lower extremities. I'm just going to do another check here at the fingers. We're going to do cap refill. So that's still good. That's under 2 to 3 seconds. Facial movements were equal bilaterally, symmetrically, and I think that will conclude everything. We have covered everything. Do you have any questions for me at this time?
No.
Great. So I'm going to go grab the doc real quick here and sit tight, and he'll be right with you.
All right.
All right. Thank you so much. You have a great day.